healthcare is what we have heard. We know that there is shortage of doctors, we know there is shortage of nurses, we know there is shortage of hospital beds. So the whole healthcare industry is under pressure. It's okay if you privatize healthcare, okay, you come, longer you stay, more you pay. However, that is not the most efficient use of the resources. The real crux is how can we run it more efficiently so the resources are used fantastically. Here is an example. You've got Nitin Parekh here. He has developed a new application funded by NHS, transforming the healthcare. How you can increase the quality of care, better, lower cost, and more control. A reminder for the patients when to take pills and all kind of that stuff, so that it's the user end, the innovation making a difference in the healthcare. Let's welcome Nitin Parekh.
I'm not sure how I can follow the previous two speakers, but I'll go. My talk today actually carries on from a little bit about the technology that's been used in electronic patient records. But I'm more interested in telehealth in general. I'll give you some statistics in a few seconds just on how important and how costly healthcare is. And obviously, therefore, we need to understand a little bit better about how we can improve things. So what is telehealth? Telehealth is a buzzword. People talk about digital health, m-health, or whatever. It's a global phenomenon, and it's becoming more and more invested in and looked at across all the major countries. It's about how we treat people at home or outside of an acute care setting. So in other words, outside a hospital, outside a GP practice, outside of a minor injury setting. Principally, it's how we treat people at home. And that usually involves the transmission and measurement of some form of biometric data, clinical data, hence clinical. What is it not? I often find that asking people to define things is better to understand what it's not. It's not about alarms, sensors, those fantastic gadgets out there that can help people in their own homes. But we call that telecare. So telehealth is clinical and it's NHS. Telecare, how we use gadgets, is social services. That's the difference. What are the barriers? Why is it I hear a lot of times people can't get technology through the NHS system? And not just the NHS, but in America and elsewhere. There are really 4 points. I'll go through this very quickly, but I think it's very important that we understand what is happening in the world today. There's one group of people called modernists. What they say is technology will solve every problem if people simply adopted it. Why can't they adopt it? Make them use it. Okay, that's a modernist. You can put Bill Gates in there. You can put Steve Jobs in there. You can put almost every entrepreneur in that category. Humanists. Humanists say it's not about technology, it's about people. Most often, or quite a lot of the time, technology is not fit for purpose for that individual. The third part is government. You can have the left and you can have the right, and I don't really care which one you are, because I'm neither. It says basically healthcare has been driven by very large private companies that are commoditizing the whole thing. Okay? And the last point, change management, we can put the NHS in there, which is basically large-scale technology is complex and needs proper organisation. Those are the 4 main ways people understand technology. To me, it's a Tower of Babel. Everyone's speaking a different language. Are you for the patient? Are you for technology? Are you for the economy? Are you for the NHS? I'm not for anybody. I'm just looking for a better outcome. Why is this important? Because they don't talk to each other. They really don't. And that's why technological adoption in any healthcare system is fraught. Why do we need a solution? I'm going to skip really quickly through these. Everybody talks about NHS. I talk about care. Care and NHS are very different things. One, Because actually, you forget the 6.5 million people in the UK every day provide care for free. They're carers. Their worth to the economy every year is £119 billion. That's more than the entire NHS budget. So when people talk about NHS, I get really quite cross, because that's not care. NHS is a subset of care. It is not care on its own. So the true cost of care in this country is over 250 billion quid. I'll skip these. It's just this one on the left is quite interesting. More NHS trust providers in deficit than ever before. What does telehealth need to do? We haven't got 250 billion quid every year. Certainly the UK government hasn't. And not a lot of other countries. So you have to triage things, okay? And the key triage is clinical, practical, and technical. Of course we need clinicians. Without Rajiv, where would we be today? Okay? But it has to be practical. People have to use it, they have to buy into it. And technical, which goes back to Rahul's point about how we secure data, methods of delivery, and so on. But never underestimate the importance of social and emotional support in technology. If you don't have that in your solution, technology adoption will not be there for you. I forgot a bit of a reputation at NHS for asking the most stupid questions. So this is a very stupid question. Rajiv prescribes the medication to a customer. The pharmacy dispenses the medication. The patient takes the medication home. Do we know whether the patient ever took that medication? We monitor the number of bandages, the amount of syringes, the amount of paracetamol in the acute setting. But we have no idea where 15 million people with long-term conditions are actually taking their medication. I mean, the mind, I find it absolutely astonishing. Such a simple question. Why does it matter? Look on the right. 1 billion prescriptions are dispensed every year in the UK. The net ingredient cost is 9.2 billion quid. That's in the community. It's the second largest cost after wages in the NHS. Forget about hospital right now. The largest single cost in the NHS is wages. The second largest is medication. To a person coming from Mars, you might think they should be the other way around. But anyway, okay? 50% of meds are not taken as prescribed. It's a World Health Organization problem, okay? 5% of all ADRs in UK hospitals are because not taking medication. So 1 in 20 beds, a block, because somebody didn't take it. But why haven't we addressed this problem? Globally, it's a £500 billion problem. So, when we actually created a solution for this, which I'm not going to go into, but what I would say is that when you come up with a solution, have a look at each of these 4 areas. If you are interested in technology and you want to see technology being adopted in any care setting, you have to look at these 4 areas. So in our world, modernist, absolutely we are. We've created technology that's easily scalable and is cutting edge, absolutely. Humanist, we put the individual at the centre of what we do. If the patient doesn't take the medication, it doesn't matter how much you spend, how much you treat that person. They can improve. So you have to ask yourself, why does that person not take the medication? Don't just assume they will do it. Political economy. Always look for the general good. You gather data to improve public services. Okay? And change management. No change. When you do technology, make sure there's minimal change in industry or user behavior. Quick reduction. Thank you.
So you would appreciate that how much change in the healthcare you can make just by small things. Billions of pounds can be saved through one simple application. And this all comes from innovation. So I think what it just illustrates in a short period of time, there is so much can be done if all of us started doing these little things together and then piece it together, the world will be a different place to live. It's not just saving the cost, it's also improving the whole health. You've seen that 5% of the hospital admissions could be saved. So that is a big number. And you can see somebody who's more ready can go in because there is space created. So the whole thing can change if we are prepared to go outside our comfort zone and do something different. Make it happen. So let's give a big hand.